We begin tonight talking about your health. Joining us is Dr. Albert Hicks. He is the Director of Heart Transplant and Section Chief for Advanced Heart Failure at the University of Maryland Medical Center, also Assistant Professor of Medicine at the University of Maryland School of Medicine. Doctor, thank you so much for joining us. In your field, there have been so many advancements, yet cardiovascular issues remain the #1 cause of death, correct?
That is absolutely correct. And mainly because the risk factors that help to develop cardiovascular disease continue to rise. Rates of diabetes are going up in the U.S., rates of obesity and hypertension, which unfortunately all lead to worsening heart disease. And then there's smoking. We haven't gotten rid of smoking, and so unfortunately there's a risk factor that's you can mitigate, but unfortunately still causes problems.
And we're going to focus in this segment on heart failure as opposed to heart attacks, which people are probably more familiar with. What's the simple explanation of heart failure?
Sure. Heart failure is basically the heart is not able to meet the demands of the body. That's the most simplest explanation. And unfortunately, we've done a great job of treating other forms of heart disease, valve disease, coronary artery disease, but all of the end stages of those disease lead to heart failure.
You brought a couple of graphics with you, which will show the trend, which is amazing stuff. The first one goes back, I think, 100 years, and there's a little. I'll explain a little. You can explain the left.
Sure.
The big spike on the left side of that is the Spanish flu, in terms of death rates. But the line that goes across the top, it's coming down, and has been for decades, is heart disease.
That's correct. So this is a slide I like to use whenever I give lectures, whether to the medical school or to other universities, and particularly during grand rounds. And it really shows and highlights that heart disease has been the #1 cause of death in this country. And even during COVID, heart disease was still the highest killer for Americans. It's something that's been going down, but unfortunately, heart failure, as one of the heart diseases, mortality has been going up.
Gotta like the trend, but there are some disparities to talk about in this, and there's another chart that shows the rate of heart failure, I believe, among African Americans, but young African. When I think heart failure, I don't think young people.
Yeah. Unfortunately, one thing that's not recognized is that there are a lot of genetic mutations that occur with heart disease, and other things that can affect heart failure. But this graph shows the top population, being African Americans, are disproportionately affected from a mortality standpoint with heart failure compared to other groups. So below would be Asian Americans, Hispanic Americans, as well as Caucasians. But for the last 20 years, mortality for heart failure for African Americans, particularly young African Americans, only continues to rise.
And for anybody looking at that thinking, all right, COVID and controversial vaccines, this chart ends around 2020, so
correct,
during the pandemic. And the third thing we wanted to look at is just a sectional of what our hearts are supposed to look like. It's the one in the middle that's good here?
Absolutely. So the one in the middle looks great. And if you want to focus on any of the chambers, particularly focus on the left ventricle, which is the left bottom chamber of the heart. That has a nice thick wall. The chamber is not too enlarged, and the valves look pretty normal. Now, when we talk about heart failure, for simplicity's sake, we're going to focus on the top that says systolic heart failure, or the one toward the left. And in those cases, the heart gets bigger, the walls get thinner, and unfortunately, they're under a lot more stress, and the heart gets weaker.
What do you have for treatment options if somebody is early in this disease process?
Early in disease process are usually just medications. If you have a reversible cause of heart failure, we like to get to that cause. So sometimes if you're having an abnormal heart rhythm and we reverse that, that can help the heart get better. If you have an abnormal deposition of proteins, something called amyloid, which can affect about 5% of African Americans, if you treat that early enough, that can help to reverse it. And thyroid disease, whether your thyroid is overactive or underactive, can be a major cause of heart failure when it's out of control. So treating that can definitely treat the underlying cause, but the medicines help the heart to normalize again.
Are there people walking around with that disease process underway who don't know it?
Absolutely. The one thing with heart disease is that the body's able to compensate very well until it can't. If you're older, you have less of ability to compensate, so you usually present earlier in your disease course. Young patients, surprisingly, and which is why the mortality rate's probably so high, is they have very stretchy blood vessels, and they tend to present when their heart is extremely bad. Some of the worst cases of heart failure I've seen have been in actually very young patients in their teens and 20s and 30s.
Why would they get it?
Genetics. There's genetic predisposition, abnormalities in various proteins that make up the heart that can cause the heart to dilate over time. Sometimes it's also undiagnosed congenital heart disease that may not have killed someone, but will allow them to have worsening heart disease over time. If
you get a checkup, even as a young person, they're going to listen to your heart, they're going to listen to your breathe, and would they pick this up?
Not necessarily. I always say that heart failure is a great mimicker. So many patients get misdiagnosed about 5 to 7 times before they actually get the proper diagnosis of heart failure. So many of my patients will say they've had, been diagnosed with pneumonia a few times or asthma attacks, or even a young person, getting diagnosed with COPD before someone that understood their symptoms diagnosed them with heart failure.
What do you have in terms of treatments? Because telling somebody they have heart failure is ominous.
It is ominous, and I try to let them know that, one, obviously we treat their underlying cause, but the medicines work. Heart failure is a very interesting thing. It tricks the body into killing itself because the body thinks that the reason you have low blood flow is because you're bleeding or dehydrated, when in actuality you have low blood flow because you have a poor functioning pump. But the body will respond by trying to save your life by raising your adrenaline levels, by causing your blood pressure to go up, by making you hold on to salt and water. Because again, that would be very helpful if you were bitten by a dog or if you've been stabbed, but not very helpful when your pump is weak and you're having problems moving the fluid around. So the medicines we give literally stop the body from killing themselves.
When does it become time to look for a transplant?
So when medicines stop working, when patients don't get the benefit of the medications, or when they're getting more of the side effects from the meds as opposed to the things that we're looking for the meds to do, then we start to look that patient may require more advanced therapies. Those advanced therapies could include heart failure devices, potentially a heart pump, like a left ventricular assist device, or we sometimes refer to as an LVAD, and potentially a heart transplant. But we have to weigh the risk and benefits because every patient's a little bit different, and I always tell my patients there's no free lunch.
Pacemakers have a role to play?
Certain pacemakers do. Then we realized that patients with heart failure initially died at high rates that were asymptomatic. They had no symptoms. They knew they had heart failure, but they would leave the hospital, the meds would work, and then they wouldn't wake up the next morning, or they would drop dead by driving. And what we found is that arrhythmias, or abnormal heart rhythms, were actually one of the highest causes of death if the heart were to fall to a certain level of weakness. So defibrillators can help catch it and treat that. And certain defibrillators, if you have the right type of abnormal rhythm, can actually make the heart stronger.
I just have a minute, but what's the main takeaway that you want our viewers to think about, and especially think about next time they're at that checkup?
I would say that if I mentioned any of the symptoms, and the main symptom is shortness of breath for heart failure. If you know you have a heart condition, if someone in your family has a heart condition, know that this condition can run in families, and please get yourself checked out. The second thing is to stop anything that can worsen heart disease, such as smoking. If you're a smoker, there's no benefit to smoking whatsoever. It raises your cancer rates, particularly raises your heart disease rates.
Any tricks for people who've tried and relapsed?
There are a lot of programs that are out there, and I say we can talk with your doctor about them as well as a social worker, but they can be very helpful into getting you to stop some of these behaviors.
Very good. Dr. Albert Hicks, University of Maryland Medical Center. Appreciate your time. Thank you very much.
Thank you.